also in search of balance, still in search of balance in my own life, still learning. But I'll talk about a few things for my own journey and things that I've learned along the way. I'd like to first acknowledge that I'm fortunate to live, work, and play, and I'm presenting today on the unceded traditional lands and waters of the Coast Salish peoples, to include the Squamish, Musqueam, and Tsleil-Waututh nations, and am thankful for the care of this land that Indigenous peoples have taken for centuries, kind of thousands of years going back, and we'll endeavor to do this in a good way. A little bit about my journey. So I started my training at the University of Manitoba, and this is a picture of the medical school in downtown Winnipeg, Manitoba, on a warm day, not in the winter. There I did my undergrad, my MD, and my PhD. Okay. And I worked with some pretty wonderful people. So I worked with Joanne Embry on the top left and Frank Plummer on the top right. They were my supervisors, and spent a little bit of, was fortunate to spend a little bit of time in Nairobi in Kenya at the Pumwani Maternity Hospital, where there was a project going looking after women living with HIV and studying mother-to-child transmission of HIV there since the late 80s. And so finished all my my thesis. You can see how old I am based on the date on the thesis, and medical school in Manitoba, and then came to British Columbia, where I did my later training and ended up at Oak Tree Clinic, where I am fortunate to still be able to work. So that's a little bit about my winding road. Okay, so things I've learned along the way. It's been a bit of a windy road. And so what I wanted to do today was just to kind of share some of the learnings that I have had about actually a variety of things, and give the pearls that I have learned to whoever kind of comes after, to see if it can make their journey a little bit easier. All right. So these are the stages of a woman's life. And it's important not to lose track of the fact that we only have so much time, and we should never make ourselves so busy making a living or doing work that we don't have time for the rest of our lives. And so sometimes we lose track of that. And, you know, my husband, for instance, this last month or so has been telling me that I'm married to another man named Grant, or I've been having an affair with another man named Grant. And when's his wife coming back? Right. So, you know, it's a reminder that Grant being, yeah, Shelley, I think you got it. Grant being a grant submission, right? Or grant submissions, because we've had several this year. But you have to remember the other people in your life and the other things in your life, and not lose track of those. Okay. So that's something just to put out there. And something that I always try to, when I mentor students and residents and others, something that I always like to put out there is have a discussion around children and babies, having a family. And I think for women in research in particular, there's only so much time to have a family, to have a baby, and it may not work out right away. So you may think, oh, well, when I'm, 37, I'm going to have a baby, and when I'm 39, I'm going to have a baby, and you may have it all planned out, but it may not always work out how you want it to work out, and it may not always work as quickly or as easily as you think it's going to. And so just to tell young women that there's never a good time with a research career to have babies. And so you need to have your babies if you want to have babies, if you want to have a family, if you want to have your own babies or adopt babies or whatever it is, or young children. You just need to do it when it's the right time for you, and figure it out as you go along, and not wait for that perfect time, because the perfect time is never going to come along. Okay, it's never going to be a perfect time. You just have to do it if you want to do it. The other thing that I think is really important to point out is that we need to look after our bodies. And it's really, we can't do good work if our bodies aren't in good shape. And it's easy to work and work and work and not look after ourselves. And so I would encourage everyone to make exercise a part of every day. So for instance, I ride my bike to work. I'm lucky enough to live close to work that I can do that. But I encourage people to kind of make a way to fit some sort of exercise into their daily lives, so that we can look after ourselves. And in so doing, we can look after the people around us. When it comes to homes and housing, these are all pictures of standalone homes, really, but I think the reality is that many people will never have a standalone home in today's society and in today's economic situation, right? And so, living closer to work may mean a much smaller home, a much smaller place that you're able to afford, for instance, than living further away. But for instance, if I had lived on the North Shore instead of where I live currently, I would have had a bigger home, a nicer home, but I would have spent 45 minutes to an hour in the car each way every day, which would have often meant that I wouldn't see my children before they went to bed. And so I made the choice, and I was lucky enough to be able to do that, to live closer to work. So it's kind of like have a discussion with your partner or think about it with yourself. And, you have to make that, what is going to work for you? What are you willing to do? And then it may have the same effect for what city you end up in, where you end up in, what jobs you take. And then what about time away? So, getting a vacation. So it's very easy on vacation to end up working a whole bunch, to end up, checking emails all the time and trying to keep up with things. If you don't check your emails, then inevitably you're way behind when you come back. And it's easy to never take a vacation and never get rest. And I think it's really important that everybody gets some rest, because otherwise we end up burnt out and then we're no good to anybody. So some of the things that I encourage, new trainees, community members that I work with, any of those people in my circle whom I mentor or I have interactions with, that it's important to take some time away and to really check out. I also suggest that it's a good idea to, if you're going to a conference, for instance, to tack a little bit of time onto that to see the place that you're going to, if you can, if it's possible. Quite often, flights can be changed or booked differently for no extra money, and part or all of the trip, or part of the part of the trip that's to do with the conference, including the travel, can be taken care of by whatever funding is sending you to said conference. And you get a little bit of vacation associated with that. So I encourage people to do that as a way to travel, a way to see new places, and any, any cost that you have to shoulder, so at least you can write it off. So encourage people to take enough time away and enough time to recharge so that their batteries are full. And for healthcare providers who are part of this group, there is the Healthcare Provider Travel Award competition through the Canadian Association for HIV Research, and this includes nurses and other allied health staff can apply for at least one of the, can apply. Pharmacists can apply to some of them, and nurse practitioners can apply to some of them, and then physicians can apply. And here they pay your entire way, including flights and hotel, and your registration to go to certain HIV related conferences. And that includes IAS and CROI and the European HIV conference, for instance. And so that's a place to find funding if you don't have funding in your envelope of money for research. For community members, for instance, IAS, we had one of our community members able to attend this year, paid through working for the Canadian Pavilion at IAS. She applied for that and was able to go and had a trip to to Munich to attend the conference and be enriched by that conference, but also to be able to expand our horizons by getting to travel. So there are other things. Universities usually have small amounts of money for funding for going to conferences. So I encourage people to kind of look into that and leverage that, and then be able to take a little bit of time away wherever possible as well. What about jobs? So what about finding that job or that position that you're going to take in, and what considerations should you take into account? So I guess some of the things, so getting that perfect position, some of the things that I would um, tell people or advise people to do would be to be collegial, right? So be someone that other people want to work with, and they will help to lift you up and get you into that position, right? So that's, I think, important. Start talking early to people who may have sway in getting you a position, or people who may have ideas about what positions you might be able to explore. So this is after training, or for our community members to talk to the people around them, talk to the mentors, talk to the PIs, talk to each other, and to explore what other possibilities are out there, because I think most people want to lift each other up and give opportunity. But if we don't know that you're looking for one, then we can't help. Okay, so start talking early and get the seed planted. Consider what you want your work to look like, right? So talk with your colleagues to get an idea. So explore that with lots of different people. What does their job look like? What does this other one look like? What are the perks and the drawbacks of each of those things? And kind of get a real idea of what kind of position you want to be in. And I guess one of the things is that you may never have more negotiating power than when you first step in the door. So remember that once you've signed a contract, um, it's sometimes hard, especially in academia, sometimes hard to have it change unless you then later find something that you can leverage, right? So make sure that you're happy with what you're being offered, or at least can work with that in the short term with some sort of a plan to get to where you want to be, in the future. Okay. And be flexible about what it is, like be able to use your imagination and be flexible about positions, realizing that some positions will springboard you to others, but don't take a job that is, going to kill you, right? So my example here is, don't take a job that is 50% research, but really it's 0.8 clinical. So that means 4 days a week clinical and 2.5 days a week research, because suddenly you're always working 60, 70 hours a week to fit it all in. And you don't have enough time. You're not going to get 50% for research. And so it's not doing you any favors. Okay. And I just love this meme that I found on the internet. And this is really about clinicians, but it's really speaks to imposter syndrome as well, right? So the horrifying moment when you're looking for an attending, but then you realize you are the attending, you are the person who's making the decisions, the one who's in charge. And so you look for the smarter attending, the someone who's successfully attending, or the attendee or attending. And so that is kind of when you're starting out, it's very common to feel like, you're an imposter, that you shouldn't be in this position, that you're not qualified enough. And it's easy to kind of look around. Is there somebody else who knows more, who's better than me? But I would say that to normalize that's a very common feeling, especially when you're starting out, right? And that actually probably most of us felt that way. And if we didn't feel that way, we should have felt that way. Okay. And I would encourage you that to help with those feelings and to help when you're first starting out, to make sure that you have mentors. This is a picture of my first mentor, Joanne Embry, who was one of my PhD supervisors. And she gave me some really great advice in life. And she actually really cared about what happened. to me and my career, right? And so surround yourself with people who are going to lift you up. Surround yourself with people who are going to give you opportunities, who are going to bring you along with them and then elevate you. Um, and just like give you opportunities to succeed, not stand in your way, not trip you up, but get it, but help to facilitate your career being what you want it to be. Okay. And also surround yourself with people, and they may be the same people, they may be different people, but people that you feel that you can trust to ask if you're not comfortable with something, you don't know how to do something, you're not sure which opportunity you should take. For instance, have those people reach out to those people. And I'll tell you that, the people on the hub that I know, the people here in this room today, for instance, all of them are those people. And, reach out and ask for help, ask for mentorship. And I would say this is a wonderful group of women who really want to be mentors and lift up the next generation, and don't be afraid to ask. So what about research? So when it comes to getting started, when you start a new position, for instance, especially if you're in academia, right? Have projects on the go so that you hit the ground running, so you're not starting from a complete stop. Because if you're an academic, the clock starts ticking the moment you sign on. And so you really want to hit the ground running. You really want to have some irons in the fire already so that you can be productive and show your productivity. And so, for instance, if you're a PhD student or a physician, consider doing a postdoc to do this, or consider liaising with someone who can give you opportunities so that you have something going when you start. And take the low-hanging fruit, right? So especially when you're starting, take those things that are easy to get started and to finish and to complete, to get yourself going, right? And take the things that are obvious. So one example, for instance, working in the Oak Tree Clinic, is I noticed that a lot of the women that I cared for didn't have their periods for long periods of time. There's really very little in the literature about why that was or what was going on, right? And so that's one of the first things I started to look at. So it's easiest to work with the population where you are in the setting that you're in, as opposed to doing something completely different from where you work, right? So finding things in that situation are best, and look for the questions that are right in front of you and work from them, right? When you are embarking on a study, consider ways in which you can leverage what you're doing to, improve your productivity. So every study that you do, you should consider, if I have to review the literature anyway, has this literature been put together or summarized in the past? Has a systematic review or meta-analysis been done on the topic already? Or, recently, or is there a bunch of literature out there that has not been included in any previous reviews and which might change the answers that are out there? And if so, that might be a good first step if you're reviewing it anyway, to kind of do a systematic review, get a publication, and improve your knowledge of the topic before you start, right? If you're doing, if you're doing a new study, should there be a protocol paper? Chivos did this beautifully, right? They had a paper that basically showed what they did, what their cohort was, and then they could refer back to that every time they published a paper. And then what questions can you answer while you're gathering your data? So if you have a big project and you're going to be gathering data for quite a while, are there questions that you can answer along the way that make sense to answer, that you could answer so that you can be productive? And then of course there's your results papers for your major questions in research. So kind of all along that continuum, it's important to kind of use what you can to make sure that you're productive. and get help. So if you're an academic or a clinician, you have access to a number of different sorts of students, for instance. So there in British Columbia, there's something called flex students. And these are medical students who have to do research projects during their medical school years, for instance. So they have to do a project in first year, and second year, and a fourth year. And they usually have a half a day a week for a 4-month block with a several week block at the end. And so if there's a small project that they could do, such as a systematic review, that would be a good topic for them. If you can get them a paper, it elevates them and their possibility of being successful as well. And it helps you. There are Masters of Public Health students, there's summer students, there's graduate students. And so bring others in to help. Quite often, and I'm kind of speaking clinicians or academic PhDs, but quite often you get so bogged down with all the administrative tasks and the clinical tasks and all the other things that you need to do. It's hard to get those papers turned out. So get help, build a team around you of people who can help. And then working with community. So I've been very fortunate to work with community over the past, probably actually since I started at Oak Tree. When I started at Oak Tree, I did talks for what was Positive Women's Network in British Columbia. They would have retreats, and women would ask for certain topics, and I would do talks for them. And then I was doing another study, and we needed to, we had a questionnaire, and the questionnaire had been done and approved and validated in a group of basically white middle class college students in the US. And feedback that we'd gotten from reviewers was very, very excellent feedback, was that this didn't really mean that it would be validated in the population we wanted to study. And the population that we wanted to look at included quite a number of Indigenous peoples and quite a number of peoples from lower socioeconomic status, quite a few people who use substances. And we're like, you're right. But I didn't really know how to go about doing this in a good way. Okay, I was fortunate to have met Val Nicholson previously through my work with Positive Women's Network, and she brought in Sandy Lambert, who is a male elder in British Columbia, and they kind of helped guide me and guide Amber, who was my student at the time. And I think what I would say for that is that it's really enriched my research, really enriched my life kind of all along since then. And I've learned so very much about the importance of having community in the work that you do. And so what I would say, the advice I would give would be to be humble. Okay. Don't go in, thinking you know everything and that you don't really need help, but you're checking a box, because that's not going to get you anywhere, right? You want to be humble. You are the student. And you want to ask for direction and take direction. So when I started, I didn't even know what I was supposed to do when I was engaging Indigenous elders. I didn't know how to start the conversation. I didn't know about gifting tobacco. I didn't know what an appropriate amount of remuneration was for time. And so I asked the questions. And I'm like, tell me if I'm wrong. Tell me what I do wrong. And tell me what I need to read. Tell me what homework I need to do. And so ask for that direction, but take that direction and do your part, do your homework, and do what's asked of you when it comes to engaging with community. Okay. And engage with community early. So, ideally you want to engage with community before you design your study, before you write your grant. You want to engage with community to maybe show them what you've done already and to get their feedback. Maybe there's an area that this is where you work, right? So you say, this is where I work. What questions do you have? in here or elsewhere. And then take those questions, and where you can, do your part. Do your part to answer those questions if it's something that you're able to do. And do your part to answer them in the way, in a good way, right? So yeah, and keep asking for feedback and keep asking direction from your community to make sure that you are doing it in a good way and you are doing it as they hoped. Okay. Now, sometimes something will be brought up and it's actually not something that you can answer, or it's something that, it's not in your field. It's something that isn't really a question, so much as a want or a need, right? And so you have to kind of address that and state what your limitations are, so that expectations on both directions are, well understood. But do take direction and do it iteratively. Okay, go slow. Don't think that you're going to engage community today for your grant that's next week. Okay, that shows poor form, and it's not. Sorry, I'm saying a lot. It shows poor form. It's not respectful to the people that you're engaging. And it does happen. Sometimes it does happen. Sometimes it is a last minute thing, and but I would say, wherever you can and as often as you can, and under every circumstance that you can, go slow, take your time, build those relationships, because they are so important. And to have community trust and to really get the questions that are important to community, you need to go slow. And then to continue to involve community throughout. If you can bring community into your research practices and have them participate in the research, have them be on papers, have community members present at presentations, at meetings, I think that will enrich what you are showing back to the community. You'll get more trust from the community. And I think it'll improve the cycle of asking questions that make sense to the community and are their priority. And your life will be enriched, because you'll get to meet some really wonderful people who really have a lot to say. So those are some of the things that I would say. So these pictures here are from back 5 years ago, when doing this study where I got involved with Val and Sandy, where some community members at one of our consultations had said that they would like to be more involved in research. They just had never been anything but the research subjects, the research participants, but they wanted to be more involved, and they wanted to learn how to do this. And so 2 of them we actually employed to help do the questionnaires with participants. They were short questionnaires that took about 10-15 minutes. So we employed them to do that. But Elder Val said that, that's probably not enough. And we agreed. We're like, you're right, it's not enough. And so, looking to Chiwos, who has for a long time, trained peer research associates or community research associates, and uplifted them with training around research. We did the same sort of thing. So you can see the kind of kitchen table format that we used for this. And we ended up with 3 community members who went through training around research how to conduct a study, what is qualitative versus quantitative research, what is ethics, what does an abstract look like, and why do you do it, and what's it for, self-care, right? And 2 of those people are actually still involved and employed in research practices today. So it's really great. So it's giving other people opportunities as well. What about funding? So the ever present question about funding. And there's been a lot of that this year, as BCC3 has been trying to renew, and we've had lots of grants going in. So advice that I would give really are to have everyone read it. Wherever possible, have your grant ready ahead of time. I am not good at this, but have everyone read it. Everyone you can should read your grant, because they will all have different aspects that they come in and they will see different things. Okay. And that includes having community read it and pay them to do it, right? Pay your community to read it. Include your community on your grant, right? But have everyone you can think of read it, including people um, who don't know your study, who aren't even on the grant. And the way you can do that is if you have a friend who has extra time, or you can use your institutional grant reviewers. So at UBC, for instance, there's the SPORE program, and you can sign up and you can send your grant off, and institutional grant reviewers will do it and reply. Several of our research institutes also have grant reviewers available for no charge, to do a process whereby you can talk with them about the ideas. You can give them the grant to read over, and they can help you with response to reviews and discussion around that, as well as kind of editing, copy editing your grant before you submit it. So do that. And then if at first you don't succeed, try again, right? So this grant here, I'm pretty proud of. This is one of the BCC3 grants. And this was the third time I put it in, right? So it was declined twice. And the third time it ranked first in the committee. And that was because finally I had everybody read it, right? And had all the feedback and incorporated all the feedback. And so finally it got there. So don't be surprised if it takes more than one time to get a grant funded. If it doesn't work all the time, there's limited funding, and there's way more people who apply than there is funding for. So don't be discouraged. Try again. What's this one? Oh, yes. So as far as research positions, make sure that it can be hard to find a research position for community members. For instance, there can be worry from one, that a grant's going to finish and then what's next, right? Because quite often community are paid from research grants and they are only for certain periods of time, right? So there are worries about that. For academics, paid research positions are getting harder to come by. So Alberta still has a system whereby research is often incorporated in the package that people get, and there's paid research time. Ontario has some, but I think it still requires you to apply and reapply and meet certain criteria to continue on. British Columbia has a limited number of paid research positions through the university. There are some other things like the Michael Smith and the Health Research BC, where you can apply for short-term funding for 5 years of salary support, a proportion of your salary. And I know that other provincial funders, so Quebec, I know, has a program whereby several of our colleagues have been able to secure funding, and then they have to apply again after a period of time. So I think, the message is to apply if you need for research protected time, apply to provincial funders, apply for those paid research positions wherever you can find them, apply to your local research institutes if they have things, apply for research chairs when and if they ever come up, right? And be creative about cobbling something together to make it work for yourself. Do negotiate up front, and don't assume that something's going to come. If you agree to something clinical, you have to realize that can be difficult, and try to negotiate whatever you can up front. And then what about time and productivity? So one of the things I often do is I have a full day where I don't book any clinic. Okay, actually I have 2 of those in my work week. And try to set aside chunks of time where you can work, where you don't have kind of a meeting, an hour break, a meeting, an hour break. if possible, a chunk of time where you can work. And that chunk of time in the day ideally would be at a time when you're most productive, right? So if you're most productive in the morning, try and make that time in the morning. If you're most productive 1 o'clock in the afternoon, just after you've had lunch, try and make it that time. But try and give yourself a slice of time every week, if possible, where you can work on those things you really need to get done that require your concentration. Organize yourself. Okay, so I make lists of things that I can do. I really need to change this to a Google Doc, I think. But this is an example of, my list to myself. And so I put all the things that I need to do, because if there's an email with something that I need to do and it falls off the bottom, I forget about it. I can't keep track of all the things, right? But if I put it on my list and I put a deadline beside it, right, then I have a snapshot in one page or one look of what I need to do, what my things are that I need to do. And as you can see, some of these are highlighted, and those are the ones that are due soon, so that it draws my attention, and then I cross them out when I'm done. So find a way to organize yourself and to keep yourself on track so that you know what things are coming up and what you need to do, how you need to triage. Set boundaries. So one of the important things, so when I'm in clinic, people are often coming into my room and asking me, what to do. So today, for instance, it's Friday. I have some things I want to do. I'm not in clinic. I'm working from home today because I know that people won't be coming and banging on my door if I work from home today. When I am in clinic and I'm working on a grant and I really need some time to focus and do that work in a way that I'm not being interrupted repeatedly, then I'll put a sign on my door. And sometimes it looks like that. Do you really need to talk to me right now? I even put stickies sometimes. It's like, leave me a note. I will come and find you when I come out for a break, right? So do things like this to set boundaries, to tell people, I can come and talk to you later, but I really need a little bit of time to focus right now, and allow yourself that time to work on a project that you need to. Emails. It's very easy to see the emails come up and feel that you need to look at them and respond to them immediately. There's very much climate of kind of immediate email returns in some places. And I would encourage you to try not to do this. It's like clickbait, like you just kind of can constantly do that. Every time you shift your focus, it takes time to get back into focus on whatever you're working on. And so email can really, really be destructive at getting a task done, such as writing a paper or writing a grant. Try to put that email to a particular time of the day, in the morning, in the afternoon, at noon, whenever it is. But you look at it, once or twice a day. Unless you're waiting for something in particular, you're only looking at it once or twice a day. And as you have those emails, you are trying to work through them and only see them once if possible. What I try and do is I look at it. If I can, I finish it immediately. If not, I put it on my list of things that I need to do, right? And then move on if I can't finish it right away. Some tasks are big, right? So some tasks I'm not going to do right away, but I'll put it on my list over here so I don't have to come back. And then something that I've started doing in the last year or two, and I'm sure this annoys people, but it's just for my own mental health. This is what I have to do. Is I have an out of office, and so my out of office, you can read it. Is thank you for your email. I'm out of office, and this here is the month of August until September 2nd. Okay, this was when I was on service, and then I was on vacation. And I'll only have intermittent access to my email. For urgent issues for the clinic, call this number. If it's research related, please call this person. And then otherwise, I'll try to respond to your message when I return. If you do not hear from me within a few days of my return, please resend your email. Okay. And then I give myself some grace. So I do try to get through all my emails. I do try to respond to all the people. I do try to keep up, right? But if I'm away, like this, I was away for the whole month being on service, where I kind of fall into a black hole and I'm working a lot on a very busy consult service. And then on vacation, inevitably, I'm going to miss emails. There'll be ones that I just never see because I can just never get back to them. And so I give myself some grace. and I do what I can, and then I move on. And sometimes I'll miss an email, but usually people will see that and they will send it again. And what I've done in turn is that when I get out of office, messages from people, and it's important that they see my email, I schedule my email to come into their inbox at 10 a.m. on the day they're back, right? So I schedule a resend so that I'm assuming that they're not going to see my email either, because they're also probably having a million emails coming into their box, right? And so this is something, and then I just let go of it, and it is what it is, right? And I would encourage you to consider something like this. You can, whatever you're comfortable with, but something like this so that you can have your own sanity. Emails can take up so much of your time. And then what about all the things that you do, whether you're a community member, an academic, a student? It's important to keep tabs on everything that you're doing. Okay. So write it down when you give a talk. So after I give this talk today, I'm going to put it in my CV. Okay. I'm going to put it in my UBC curriculum vitae for faculty members. I'm going to write it down, and I'm going to keep track that way. If you don't do it as you do it, you're inevitably going to forget some of the things you did. And then when it comes time for promotion, you won't have everything you did in your record. Or, scary, you're going to spend weeks trying to go through your emails and your folders to figure out what it was you did over the last few years, to do those applications for promotion, for instance. Or when it comes time to do your common CV for CIHR. So if you are putting in a grant, you're on a grant as a co-investigator or the primary investigator, principal investigator, you're going to have to fill out this common CV, right? The first time you do this is really pretty terrible. But having at least it written down in the CV, then you can just go and see what you've done since last time and add it as you need to. But I would recommend doing it periodically. When it comes to community, this can be a really daunting thing to do, the Canadian Common CV. And I know that CIHR more recently has allowed for an applicant profile CV, which I think is actually a much kinder thing, weighing in at 3 pages. Shelley can tell me what she thinks about that at the end. But I encourage, if you're working with community, that you either take time yourself or pay for one of your research team to sit with your community member and go through and help them do the common CV, especially for the first time, because it's really daunting and really a big thing. And so spending time together working on that is a great investment, and it's well worth it. Okay, everybody, that's all I've got